Okay, now we're going to show you how to properly put a muzzle on a patient. This here is Jack, and my assistant Melanie has a good slip lead on Jack to have proper control of him. I've chosen two different types of muzzles. One is a little bit larger and one is a more tighter fit. This one, even though it's a little bit larger, I think we're going to use it just because it is more rigid, and Jack, being a Cocker Spaniel, does have a little bit larger nose than more of like a collie type dog. Number one thing you want to do is make sure it's adjusted properly before putting it on your patient. So you want to make sure it's loose and not too tight. The little back clip right here, it's much easier to tighten when it's on the patient's nose rather than to loosen it up. So you want to make sure that it is loose. That way, once you clip it behind the patient's ears, you can tighten it. And my assistant Melanie is going to get a good hold on Jack. And anytime you put the muzzle on your patient, you don't want to do it from facing them, because some of the more aggressive patients can lunge at you and try to bite you. So you always want to come from behind, and it's one fluid, swift motion. So Melanie's going to get a good hold on Jack. I'm going to come from behind, slip it over, go behind his ears, and then clip it, making sure that I'm not going to clip his ear hair in there. And then I'll tighten the clip. So that's a pretty good fit on Jack. It's not covering his nose. You want to make sure it doesn't cover his nose. He's still able to pant a little bit. You're able to assess his gum color. And whenever you're working with a muzzle, you want to keep in mind that you always want to pay attention to your patient. So especially if the muzzle is a little bit tighter than you would like, you want to make sure they're able to breathe, they're able to pant if they need to, and they don't get too stressed with the muzzle on. If they are getting too stressed with the muzzle on, then you want to maybe think about using a chemical restraint or a different form of restraint. So to take the muzzle off, you simply unhook it, and normally the patient will just get the muzzle off. You never want to pull the muzzle off the patient's snout, because the patient can bite you that way, and you always want to use extreme precaution, since normally when you do muzzle a patient, it is an aggressive or scared patient. And that's how you okay, we're here to show you how to demonstrate restraint with a rabies pole. Jack is not a vicious patient, but if he was, Michelle would want to use a longer leash, stand away from the patient, or if he's in a cage, not be in the cage next to him. So we have a rabies pole that has the hook or the noose at the end, and then we extend the arm back to close the noose. And sometimes ours gets a little stuck. Okay. So what we're going to want to do is just gently having a good distance and not having your hand down here. You want to have your hand up here. Slip it around his neck and then extend the arm back. And now I have restraint of him. Okay, and that's how you do the rabies pole demonstration. Next I'm going to show you a different restraining device other than a muzzle and a rabies pole. This is a simple towel, bath towel, that we can use to help restrain a cat who is not so excited to be here, who's nervous, stressed, or anxious, or fractious. You always want to make sure that you lay out the bath towel flat. Place your patient, which will be a feline. It's typically good just to use in felines. In the center of the towel, while still holding the patient, you want to place one side up and tuck it in, and then the other side, you want to bring it around and tuck it under. It's often called a kitty burrito too. That way I will always have one hand on Morgan's head to control it and one hand on her rear to control her, keeping her from jumping or clawing or fractious or biting, and protecting us and the doctor. So if the doctor wants to examine her face, she can simply, or he can simply lift up the towel, examine the face, Okay, now I'm going to show you how to properly obtain a urine sample through catheterization of a dog, a male dog. And this here's Marley, and he's been having some urinary accidents, so we're going to get he won't go outside for us, so we're going to get a catheterization, which is probably better than a free catch because it's going to be, have less bacteria in it, be a little bit more sterile, that type of thing. All right. And the only thing I forgot to get is paper towels, so I'm just going to go get that real quick. All right, so I have some diluted chlorhexidine solution scrub here. First, what I'm going to do is I'm just going to scrub his penis to remove any type of debris. And it's always best to have them in a lateral recumbency position on their side and have them relaxed. All right, next I'm going to get his penis to come out and scrub that, making sure all the hair around the area has been clipped and scrubbed. Trying to make it as sterile as possible. Okay. Now I'm going to use a 3.5 French catheter, being very careful to make it as sterile as possible. I have gloves on, and I'm going to place the catheter here on the floor, and then dropping some lube because we want to lube the tip of the catheter. Okay. So all right, we have our syringe and our catheter tip. I've lubed the tip of it. Retracting his penis, making sure that I keep it up in the air, not touching the ground. And slowly feeding it. If I feel any type of resistance, then I know there might be a possible obstruction, so I'll get the doctor. But this one's passing nice and easy. No issues. All right, so I've kind of gotten to the end. So now what I'm going to do is I'm going to take the syringe cap, place it on the end, and aspirate back. Always applying negative pressure on the syringe to obtain my sample. Okay, once I get a good enough sample, still applying negative pressure, I'm going to clamp the catheter and gently pull it all the way out. That is, okay, we're here with Brandy. We're getting a free catch urine sample. She is a female, and I've already used a diluted chlorhexidine scrub to scrub her vaginal fold. And her hair's already clipped back there, so it's nice and clean. This is a sterile bowl that we're using, and I'm using gloves to prevent any urine from spilling on me, just in case she would have a zoonotic disease like leptospirosis. So we're going to walk outside now. And anytime you get a urine sample, it's always best to know, number one, if your patient is a boy or girl, and to clean the area around their penis or vagina. So Brandy's going to come outside, and I'm going to catch it midstream in the bowl, and then I'll take it to the lab and analyze it. Okay, we're here with Tio, and we're going to demonstrate how to do a cystocentesis urine sample using our ultrasound to guide us. So Tio, we've clipped his hair and scrubbed his abdomen around about where the bladder is. We just have a small window. And we scrubbed it using the 3-scrub technique with diluted chlorhexidine and alcohol. And Ashley, the technician, has found with the ultrasound probe where the bladder is. and she's using a 3cc syringe, and then her needle is a 22 gauge, 1.5 inch needle. It's okay, Tio. Okay, and she got her urine sample, and now we're going to proceed to run it. Okay, we're here with Penny. We're going to show you how to express her anal glands. So I'm going to kind of pet her just so she knows that I'm right here at her tail base. Gently lift up her tail, and I have a glove with sterile lubricant on it. I'm taking my pointer finger, slowly going into her rectum, and I feel 2 small glands. First, you want to palpate just to make sure you feel anal glands, to make sure you don't feel any tumors or masses on the inside of her rectum, and look to make sure you don't see any on the outside. Everything feels normal in there, and the anal glands are located at the 5 and 7 o'clock position of her rectum, and I'm going to slowly, starting at the back, pressing with my thumb on the outside, milking the material out. And you always want to check just to make sure that there's no blood or pus that would indicate her anal glands are pretty full. That's why the paper towel's at the bottom. No blood or pus that would indicate an infection. And I'm going to take the baby wipe here, wipe off the material, checking the material just to make sure there's no blood and pus, and then we'll spray it with a little bit of cologne. And that's how you express her anal glands. Okay, we're here with Daisy here, and we're going to show you how to do a nail trim. Nail trims on dogs and cats should always be done with 2 or more people, 1 person restraining and the other person doing the nail trim. Melanie here is restraining Daisy, and I'm going to show you how to do a nail trim on her properly. There are a bunch of different types of trimmer devices that you can use. These types are what I typically like to use, the Miller's Forge nail clippers. We also have the guillotine nail clippers. The number one thing you want to keep in mind is when you're doing a nail trim is to always be prepared. So the main blood supply that runs through the middle of the nail, you can see them on the light colored nails like Daisy has. On the darker color nails, it's a little bit more difficult to tell where the quick is, so you always want to be prepared with aseptic powder, or cornstarch works well in a pinch. So you always want to have some of that prepared if you do quick their nail. Also, they make a variety of Dremels that are safe to use for pets to file down the nails. Some pets have had bad experiences with the nail clippers, so a Dremel often works better. Other pets don't like the noise of the Dremel, so it's important just to feel your patient out and see what works best for that patient. We are going to use these clippers, and I'm not going to show you how to do all of them to save time, but at least show you at least 1 foot. And Daisy here has nice clear white nails. So what you want to do is, I always start with the dew claw first, just making sure that you can cut the dew claw, and you want to kind of push it up with your middle finger, and then take just a little bit of the tip off. You never want to go take too much off too fast, because you don't want to quick your patient. And then when you go to the next foot, just take a little bit of the tip off. I can see that the quick is here, so I don't want to go any more. And same. Daisy, it's okay, honey. It's alright. It's alright. It's alright. That's a good girl. That's a good girl. Alright. And we're going to move on and do the other nails. It's okay. It's okay. Look at me. Look at me. It's okay. Okay. And now I'm on the last one. I just want to make sure that I'm not clicking her. It's alright. It's okay. And sometimes when it comes restraining a patient. Daisy here, we can tell that doesn't like too much heavy restraint. So we'll just kind of go slow with her and take little quick breaks and stuff. That's how you do a nail trim on a dog.
Okay.
All right, we have Sasha here, and we're going to demonstrate how to do a nail trim on a cat. So Melanie has her in lateral recumbency to restrain her. And we're going to start on her back feet. In cats, their nails, they do have all usually white nails. And what I do is I take my thumb and I place it on top of the nail, and then my pointer finger on their pad to kind of extend their nail out. And I can see, since they have the clear nails, you can definitely see the quicks. Okay. And then we'll show you up close a little bit so I can see the pink quicks. And I just go right ahead of them. Another guideline is kind of where the nail hooks. All right. And Sasha's front declawed, so we're only going to do her back feet. Okay, now we're going to go over the proper pilling of a dog patient. This is Jack, and Jack we're going to pill with his probiotic. So whenever you pill a patient, you have different types of techniques you can use. You can hide it in these greenies pill pockets, which are different flavors. They're kind of a gummy type texture that you can put the capsule or the tablet around and then feed it to the patient. You can use some canned food, form a little meatball. You can use a pill gun, which is this type of system. It's just a long tube with a rubber plunger, and then a rubber piece at the end to hold the pill in place, and then the plunger goes down. You put your pill in here, and then when you push with your thumb, this plunger goes and it releases the pill into the back of the dog's mouth. Or you can use your hand. For this technique, we're going to go over hand pilling of a dog. So you want to first make sure, anytime you're giving a medication, make sure you read the label, that you give the appropriate amount and it's the correct medication for that particular patient. So this says, Jack LePage, give 1 capsule by mouth once a day of the veterinary mega probiotic. So we're going to get 1 capsule out, and you always want to do this with an assistant, never by yourself. So we have Melanie here holding, and you first, anytime you work with a patient, like I've said before, you want to go up and kind of talk to them first. You don't just want to charge at them. So Jack's a good guy, and we'll kind of talk to him, kind of rub his muzzle just to let him know that we are going to open up his mouth. And then I'm right-handed, so I'm going to have my pill in my right hand and then open up the top of his mouth with my left hand. So I will kind of grasp his muzzle, separating the mandible from the maxillary, and then open his mouth, and with my 2 fingers put the pill down his little throat and then close it. And then you always want to close it to make sure that they swallow. Okay. And once they've swallowed, and Jack actually didn't swallow it, so I'm going to try it again. With these capsules, they're a little bit slippery, so it's a little bit harder, but you want to do the same technique, open, and then push it down until he swallows. And he's good. So we'll go one more time, down, making sure that we go all the way back, and then close it until he swallows. And I could feel when I'm going back and pushing it back down that I'm actually pushing it down. And then it's always good for positive reinforcement to reward him with a little treat, since he was such a good guy. Give him a little cookie. It's a good boy, Jack. That's a proper hand pilling for a dog. Okay, now I'm going to show you how to manually hand pill a cat. This is Honey here. Honey has a pretty bad flea infestation, so we're going to give her a Capstar. The doctor handed me the Capstar, and typically you would have a pill gun But we're going to show you how to manually hand pill. So I'm going to put my hand in between, behind her jaw, facing her up to the sky, lift up, and then just drop the capstar down in there. And close her mouth, kind of rub them. Okay, now we're going to show you how to properly clean the ears. We have our patient here, Daisy, and Daisy does not have an ear infection. She's just here for a simple routine grooming. So her owners requested that we clean her ears. We have a couple different types of ear cleaners. This one is the Epiotic. It's just a generalized ear cleaner, and it's non-irritating. It's an antiseptic. And then this one is a Malicetic Ultra. It's used more as an antimicrobial, anti-inflammatory, and an antifungal. Deep cleansing and drying agents are in here as well to help, especially if they have like a yeast ear infection, to kind of help with that. So since Daisy's just here for a routine ear cleaning, we're going to use the Epiotic. We have our cotton balls here, and then also our cotton tip applicators or Q-tips. Anytime we do a good ear flushing, what you want to do is make sure that this is a cleaned cap, that there's no residual earwax or debris on the cap. So you want to clean your cap, open it slightly, not all the way, just slightly, and then always start by putting a little bit onto your cotton ball, and then opening up Daisy's ear canal with your assistant restraining your patient, and then always just kind of squeezing a little bit to really flush that cleanser down deep in there. And then do a gentle massage. Typically they tend to like this. It feels good, almost like if you were itching the inside of your ear. And then lift the flap up, and then pull out your cotton balls. And you want to do this about 2 or 3 times. And then Daisy, sometimes they like to shake to really get all that debris down in there out. So, and Daisy, since she is a Basset Hound and she has the large flappy ears, we also want to make sure after we do this that we really clean all of the kind of nooks and crannies. Yeah, and sometimes they can get debris that kind of settles out here, so you want to make sure you wipe all that off too. Alright, do a last little flushing. And their ear canal is kind of like an L shape. So what I'm doing is I'm kind of squeezing that cotton ball to get all of this cleanser down into the ear canal. And you can kind of hear the scrubbing action. Alright. So next I'm just going to take another cotton ball, kind of wrap it around my finger.
Yeah, all the cremation guys here. He's standing back there like that.
Okay. And then we're going to follow it by the Q-tip just to work in there and get all of the little nooks and crannies. Okay. Alright, and that's how you properly clean the ears. Later we'll show you how to medicate the ears. Okay, we're here with Jack again, and we're going to show you how to properly put the ear medication in. Jack does have an ear infection, and his doctor prescribed him Momenamax, and the instructions are instill 2 drops in his left ear once a day. So whenever you apply an ear medication, you want to make sure that you have somebody helping you restrain the patient, which Melanie is doing a wonderful job. And we have Jack, who's a sweet guy, and you kind of talk to him first, let you know, kind of rub their ear before you put the medication in. And then you want to just lift up his ear flap. If you notice a lot of waxy debris or a lot of stuff in there, you don't want to ever apply the medication when your ear canal is full of debris, because the ear medication will have a hard time getting down to work and to medicate. So Jack's already had his ears cleaned, and we will remove the cap of the Momentum-Max and instill 1, 2 drops. And then return the cap on the medication and kind of massage the ear medicine down into Jack's ear canal. One important thing that you want to remember when doing the ear medication as well is you want to make sure that with your applicator tip, that you do actually do the correct number of drops and do get it in the ear canal, which is the hole that's right there. And this Momentum-Max has a great little applicator that you're able to really guide it down in there. Okay, we're here with Tio, and we're going to show you how to clean his ears. So Tio does have an ear infection, so we're also going to show you how to apply his ear medication, which is Momentum-Max. So just like you would a dog, what we do is we have our cleaning solution, which is just a generalized cleanser. It's an epiotic. Put some on our little cotton ball, and then just stick the cotton ball kind of down in his ear canal and massage it a little bit. And then the kitty cats, they, just like the dogs, they do like to shake some. We're getting out all of the waxy debris, and he has some yeast and bacteria in there too. So once you do the cotton ball a couple of times, then we'll follow it to get all up in this little nooks and crannies with the Q-tip. Okay. And then our cotton tip applicator, we'll just squirt just a little bit of that epiotic cleaning solution in there. And I'm not going down deep, I'm just getting mainly the outside. Okay. So since we've just cleaned his ears, now we're going to apply his ear medication. And he just gets 2 drops in each ear once a day. So we're going to put the 2 drops in the left ear that we just cleaned, and I'll just lift the flap back, and I can actually see into the canal, measuring out my drops. 1, 2. And then I'll massage the liquid down in there. We'll do the same thing for the right side, but just to save time on the video, we're only going to do the left. Okay, now we're going to show you how to put a topical medication on a patient. So Jack's going to be our little test patient. He's already had his monthly frontline, but we're just going to show you how you would put it on. So Jack here is 26 pounds, so you want to make sure that your topical medication, if it does go by weight, it's in the correct weight range. So this one goes from 23 to 44 pounds. You want to take your vial, and you want to, we're not going to do this, but I'll show you how to do it. But you want to just break this seal right here, and this is the frontline tri-tac. And then once it's broken, keep in mind that it will be open, so you don't want to pour it because it will go all over the place. But you'll take your patient, and we always apply these topical types of flea and tick preventive medicines in between those shoulder blades. That way they cannot lick it off. So I will palpate Jack's shoulder blades and try to move the hair. And then once the seal is broken, I will break it and then squirt all the liquid in between his hair, kind of pushing it down into the skin, and then push the hair back to normal. You don't want to push it to where your hand's covered in the medication, but just kind of gently pushing it from the top, kind of back a little bit. And then you always want to wash your hands after you put on any type of topical medication. Let the owner know or your other family members know that Jack does have the Frontline or the Revolution or whatever type of topical medication you put on them. That way they know not to touch this part of them and kind of rub them real good back there. Anytime you do a cat with any type of topical medication, It's always a good idea just to put them directly into the carrier. You want to do the topical medications at the end of the physical exam, not at the beginning, since the doctor will want to palpate the shoulders and might want to check for fleas or something like that. Okay, we're here with Daisy. She's under general anesthesia, and we're going to show you the proper way to do a gastric intubation with her. She is in the proper position, which is right lateral recumbency. She has an endotracheal tube in and a mouth gag, and we're just going to measure our GI tube. So what we want to do is we want to palpate her 13th rib, which is right here. Take the end of it, place it on the 13th rib, and then have it in a natural positioning, and then we will take and tape where it's going to be on the, take it all the way to the tip of her nose. So I'm on the 13th rib to the tip of her nose. I'm going to hold it in place and wrap my tape around it. Okay, and that's how you...
We're going to apply a little lubricant just to make sure so we don't traumatize the esophagus. This patient is fully intubated, so it'd be darn hard for me to go down the wrong chamber. But she's measured that, and sometimes because it's dry, it's not going as Whitney started out, we're going to attempt to do this, and I was getting hung up mid-thorax from our measurements, even though she's a little out of the anatomy with this elongated body. So we rotated the patient to left side down, and when we did there, we could feel it then advance past that section. Now we probably measured her. That's actually, now I'm stopping, and there's our tape mark. But sometimes what may be on paper, I'll sometimes even have them upside down on their spine if I'm not getting the normal. I do not want to force this, but sometimes it's just the way through this long body and the position of the heart and the trachea that maybe that esophagus had a little kink, no different than when we do things rectally. I don't force, just like when you're taking a temperature. So Whitney's measurement is correct. It advanced exactly where we want. You can actually feel it in its location here past the 13th rib. So we are there, and you can actually see a movement right there when I do that. And we're now going to extubate and take out the stomach tube, and then they're going to, we took the monitor off just temporarily on Daisy, and then we're going to go ahead and have this patient come up in the next few minutes after surgery.
Okay, now I'm going to show you how to measure the intraocular pressure of one of our patients. We use a Tonovet measuring device. It is one of the best devices on the market for small animal medicine. It's already calibrated for small animal use, so you want to make sure if you are using a different type of equipment that it is calibrated for the small animals. And it comes with a nice little base that you can use to rest it in when not using it. And it comes with disposable calibrated little balls that are magnetized. And what you want to do is you want to put the pen, once you turn it on and it says load, you want to put the sterilized pen into the chamber and press the button, and it will automatically calibrate it. If you were able to see it, it moves the pen back and forth. It is magnetized, so it will not fall out. You always want to make sure too that you loop it around your wrist for safety purposes. Normal intraocular pressures for dogs is between 15 and 25. For cats, it's between 17 and 20. Anything over that pressure might be considered glaucoma or just an increase in eye pressure. So you want to record all of your results in the patient's medical chart, and good medicine practice is to obtain 3 readings in each eye. Okay, so next, now that I have the Tonovet ready, and our Tonovet is self-calibrating, what that means is it calibrates for gravity and also the natural intraocular pressure. So ours is self-calibrating. Others, you have to manually calibrate it. So that's something too, if you're using a different piece of equipment, to keep in mind that you might have to manually calibrate it. All right, so now we're going to move over to our patient. All right, and we have Jack here. You never want to do this by yourself. You always want to have somebody restrain your patient. And when they are restraining the patient, you never want them to have a strong hold of their neck, just because if they do have a strong hold of their neck, it can make the pressures have a false reading of higher than normal. When I'm using my TonoVet, I want to keep it at a parallel level with the eye. Like I said, you want to do both eyes. So I'll first do his left eye, and I will just take my finger on my left hand and kind of raise his eye up a little bit, making sure I'm parallel, and then pressing the button 6 times to get a reading. So I got a reading of 16, which would be considered normal, but like I said, good medicine practice, you want to check it at least 3 times. Okay, I got reading of 15. And then I got a reading of 14. So he would be considered normal, not an increase or a decrease in his intraocular pressure. Do the same thing for the right side. Okay. Okay, and that one we got a reading of 16. We got another reading of 16. And we got another reading of 16. Also, when I'm doing the readings, the TonoVet has a standard deviation bar, and you want to make sure that the standard deviation bar isn't high or low. You want to either have no bars or a middle standard deviation bar. So we got a reading of 3 16s on his right eye, and then a 16, 15, and 14 on his left eye, and we want to record that in the chart for the doctor. Okay, now we're going to show you how to do a fluorescein stain on a patient to check to see if they have a scratch on the cornea or a corneal ulcer. So typically you would do this on a patient that has any type of eye discharge, especially if it is green or yellow tinge or milky in color. If the patient keeps rubbing their eye a lot, anything like that, you would do a fluorescein stain to check. So we have a couple different types here in the hospital, and the book also talks about a couple different types. The first thing is anytime you do a fluorescein stain, you want to put a proparacaine ophthalmic solution in the eye just to numb the eye. Typically, this will take a couple minutes to take effect. So this is kept in the refrigerator too, so you want to make sure that it's kept in the refrigerator. So we're going to test Jack's left eye since he's been having some discharge. So I'll lift his head up and then put 1 drop in that eye. Okay. So then we have the ophthalmic diagnostic fluorescein sodium stain strip that you can put in the eye. However, we also have a refrigerated fluorescein sodium ophthalmic solution that is a dropper, so it's not the strip that you would have to put the sterile eye wash in to activate it. It is just in a liquid form already. This also has proparacaine in it too, so kind of doing double duty, and we'll let the proparacaine take effect for a little bit longer. We use, just to be absolutely sure, if there was a corneal scratch or ulcer, the stain will absorb to it and it will turn bright yellow in color. So typically you can see it without the use of a woods lamp. However, we do have, it's a black light, also called a woods light, that we'll use just to double check, just to make sure. The only thing with this is you have to make sure the room is dark to use it, or else it won't show up. So, all right, now we're going to put a drop of our stain in here. And you always want to make sure you have plenty of gauze handy, because this stain does stain the patient's fur. It'll stain your hands and turn everything a highlighter color. So you want to make sure you have gauze so it doesn't get over everything and stain everything. All right, and I've loaded my dropper. It's already check. All right, and I'll have the gauze right there, lift his eye up, and then just put one drop in there. All right, once I put the drop in there, I'll kind of let it sit for a second. All right. All right, now I'm going to turn off my lights. All right, Jack, it's going to get dark. And have my woods lamp on, looking for any type of scratch to the cornea. So I went a little heavy on the stain, so what I'm going to do is I'm going to flush some of it with the eye wash. That way I can kind of see a little bit better. And you want to tilt the patient's head up so gravity will bring the excess stain in the eye wash down. And kind of open up his eye a little bit. You never want to have your eye wash touching the eye. All right. Now let's try this again. Okay. So now as you can see, I'm holding his eye open. I'm examining all parts of the eye. I do see where the stain uptaked a little bit of the mucus on the edge of his eye, but I do not see any evidence of any corneal ulcers or scratches. Okay. So that would be a fluorescein stain negative. Turn my lights back on, and now we'll just rinse one more time. Anytime also you're doing this, you always want to alert the owner that you have used a fluorescein stain, and since your tear ducts are connected to your nose, sometimes they will have some nasal discharge that might be this highlighter yellow. Also, when they kind of tear a little bit, their tears might also be highlighter yellow for the next couple of minutes to an hour. That's just to prevent the owner from calling back saying that their pet now has some yellow discharge coming out their nose or their eye. He was a good guy. All right, and that's how you do a proper fluorescein stain on your patient. Okay, now we're going to perform a dry eye test on our patient Jack. I have Melanie here restraining him for me. In the dry eye test, you use these Schirmer tear test strips. They come in a sterilized packet. And the strips look like this. They are labeled right and left eye. Typically, when you do a dry eye test, you are measuring the production in both. And it has a little blue line right here that's an actual blue dye. And when you fold the flap over and you insert it right here in their lower conjunctiva, you want to hold it for 1 minute, and then the dye will recede back and you measure the amount of millimeters per minute. So we will open up our packet. Some dogs you can do it 2 at a time, but the majority of the time you do one eye for 1 minute and then do the other eye for another minute. Okay. So we'll start by doing this left eye, and we'll fold the strip down and then pull down his conjunctiva and insert it right into that pocket, and then hold his eye down for 1 minute. I have a clock right there that I am measuring 1 minute. And anything above 15 millimeters per minute is considered normal. Anything below 15 millimeters per minute is considered abnormal and would be considered your patient having dry eye. This is a completely non-invasive procedure, so it's really nice, and results can be obtained within 2 to 5 minutes. So it's pretty quick, pretty simple. And we're 30 seconds into our test. And typically patients do tolerate this pretty well. Okay. And it's been 1 minute. So I'll show you the results on the left eye. As you can see, the dye has receded. It's marked at 25 millimeters per minute. So like I said, anything over 15 would be considered normal. So the patient does not have dry eye. So we would do the same on the other side. Same technique, and we'll write and record the results in his medical record. Just to save time, I was only going to do one eye. But typically you will do both eyes. All right, we have Studley here. We're going to show you how to do a patient enema. Studley does not need an enema, so we're not going to do it, but I'm simply going to go over the procedure of how we would. So if Studley was constipated and he needed an enema, we have our red rubber catheter. It's an 18 French, and we have our 60 cc syringe. We also have water here. This is warm water with just 1 or 2 drops of a liquid detergent. You don't want to do more than that since it can be irritating. And then we have our lubricant here. So we have a paper towel that we're going to smear a lot of lubricant on. Sorry about that, Studley. And what you want to do is you want to just run the tip of it, make sure you get it a good coating through the lubricant with your syringe loaded with the warm water, and then lift his tail up and insert, and we're not going to do this, Studley, insert the red rubber catheter. You only go about 5/8 of an inch into his rectum. And then you gently push the water mixture in there. And then you, of course, if you were actually doing this, you would want to have towels down since it will be rather messy. And that's how you would do the enema. Okay, we're here with Brandy. She's a Sheltie and she's in renal failure, and I'm going to show you how to do sub-Q fluid, administer sub-Q fluids to her. Since she's in renal failure, she does come in every other day to get her fluids. We do 200 mLs at a time, and she has her own personal bag. It's a 1 liter bag of lactated ringer solution with a line, and then we use 18 gauge by 1 inch needles for her. So anytime you do sub-Q fluids, you want to make sure you put a fresh new needle on. So we're going to place the needle just like that with the cap still on, and making sure that when I take the old needle off, I do not set this on the ground, set it on her, set it on me to prevent contamination. With Brandy, we do track where we do our sub-Q fluids, so we don't do them all on the right side, all on the center, or all on the left side of her. You typically do them on the upper portion of their body, and she's due for it on her left side. So what you do is you pinch a little bit of skin up to get a nice tint, and I can see her skin, and I aim right in the center, the bevel up, just like that, and it should go in very nice and smooth. Okay, now I'm going to keep holding on to the needle and turn the wheel all the way up to allow the fluids to flow. You can see I have a nice flow of my fluids. You always want to have an assistant holding her. Brandy's a good patient, so we're not using too much restraint, but she gets 200 mL. So to save time, I'm going to stop the video in a second and let the fluids flow. But anytime you're doing sub-Q fluids, you just want to make sure gravity, so the bag is above the patient so the fluids will flow regularly. If the bag was down here, the fluids will not flow. And make sure your patient's calm, and always make sure you know where you started, that way you know where to end. So we started at the 500 mark, so we're going to go down to the 7. That's 200 mLs. And then when you stop doing the fluids, you just want to turn your wheel all the way down and take your finger, and we're not going to do this since she still needs to get it much more, but take your finger and gently pull out your needle, and using the one-handed technique, put your syringe back into the cap. And normally, since you are doing fluids under the skin, you will need to put your finger, or we use a piece of gauze here to stop the flow of it to come out. Okay, we are here with Powder, and we're going to show you how to put a modified Robert Jones bandage on her. I'm going to start by putting little stirrups on her feet and using a tongue depressor to hold them from sticking together. Okay, and now since this is a modified Robert Jones on her hind limb, we're going to go all the way up to here and all the way down, except we're not going to cover her last 2 toes. Okay, I have my stirrups in place, and I'm going to take my cast padding and lightly wrap, starting from distal to proximal around her foot, and each layer I'm going 50% into the other one. Making sure that I don't have it too tight or too loose. And she does have a lot of hair, so that's nice because that does offer some natural support, so I won't compress it too much. I'm going up to our little stifle. Okay, now that we have the cast padding layer on, we are going to take our cling layer and start the same way, proximal to distal, making sure that we're not getting it too tight and applying too much tension on it. And Powder's being a wonderful patient. Okay, the cling, it does have a lot of tension, so you really want to make sure that you don't get this layer too tight and restrict. Okay. So now that we're through with this layer, we're going to do our last layer, which is our layer of the vet wrap. Okay, start the same way as all the other ones, proximal to distal, and when I stretch it out, I want to make sure that I give a lot of give in between, and I'm doing a 50% each time, so I'm not wrapping it around too tight when I stretch it out before I roll it on. Okay, and you always want to make sure that you don't, you want to have your cast padding sticking up a little bit so you don't cause any chafing. Alright, I'm going to take my bandage scissors and cut. Alright, lastly I'm going to rip my stirrups and put them up. Alright, now I'm going to, and I should have done my stirrups before I put my vet wrap on, but we're just going to do a quick vet wrap And then for extra layer and padding when she walks, this is a heavy duty elasticon. We're going to put this around. And that'll give her foot some nice padding. And then we'll do the same thing up top. And since she's so hairy, I'm going to have Abby kind of smooth the hair. And I'm actually going to pre-cut the elasticon so it doesn't crink. All right. All right. And that's the proper modified Robert Jones bandage. If I was taking this bandage off, I'd use my bandage scissors, and we can actually unroll this layer. And then go up, making sure that I have my blunt force end, and just slowly cut the layers away. And keep in mind, when I had my Robert Jones, the 2 toes in the middle should always be exposed to check for swelling. Now, it's always a good idea to know a history of why this bandage was put on. If it was put on because she recently had an orthopedic surgery to stabilize her knee, then you want to know to not cut anywhere where her incision would be. So it's always a good idea to cut away from where an incision and where a wound is. All right, now I have my first layer off. All right, now I can tackle my second layer. Okay. All right. I have my last layer off. And last but not least, we want to pull the stirrups. And keep in mind, this is tape, so it might be a little sensitive. Okay. And that's how you safely remove the Robert Jones bandage. Okay, now we're going to show you how to put on a splint on Powder's back right leg. This is just a plastic splint that we have here. You want to make sure that you choose the appropriate size. This is called a quick splint. We have a size small for her since she's only 13 pounds. And then you want to make sure it's labeled correctly. This is for her right rear leg, and we have up here her right rear leg. So first you want to take some tape and make your stirrups. So you tape that right there. Another piece approximately the same size. Tape it to the inside of her little foot, and then you take your tongue depressor, hold it together. That way you can easily undo them. Alright, the first layer is going to be your cast padding. You want to make sure that you don't go all the way down on the foot. You want to leave exposure to the last 2 toes, and you want to roll it distal to proximal with 50% overlap. And you always want to take Powder. This is just a mock bandage, but if this was a real bandage, a real splint being put on, if she had an injury, you want to take great care to make sure that you have somebody like Abby that's going to restrain her and help you and stabilize her leg. And I'm making sure with the cast padding that I'm not rolling it too tight, making sure that I'm going appropriately up her leg. Okay. Alright, now that I've gone all the way up, now I put my splint on, measuring it to making sure it's in the right location. She's able, it's the right bending. Alright, and then I'm going to put my contouring stretch gauze bandaging. I'm going to do the same thing, roll from proximal to distal. Powder does have a lot of hair. She did not have a lot of hair. We might want to put another layer of the cast padding on to give them more support, but she has a lot of hair. Okay. I'm putting my elastic cling on the exact same way as I did my cotton, 50% out overlapping. Alright, next we're going to want to put our stirrups up. So you kind of fold them and raise them up. And as you can see I have my bottom 2 toes exposed. And then we put our layer of vet wrap on. And apply some pressure with the tape. Alright. Alright. Do the same thing, roll from distal to proximal, 50% overlapping. And this definitely has a ton of tension. So I want to make sure that as I'm rolling, I'm also letting out. And you want to make sure that there's no creases, nothing that can cause irritation, no hair stuck. Alright. Powder's going to have a stylish combo bandage. When I get to the top, I want to make sure that the cast padding's there and I'm not putting it directly over her skin to cause chafing. Okay. Finally, we're going to put, just like we did on the regular modified Robert Jones, we're going to put a little booty at the bottom. I'm going to use this one because that one was a little big. Just a little elastic on, going around to give her some traction to help with the wear. Since she will, depending on the severity of her injury, she might be walking on it some. Keep in mind the middle 2 toes are still exposed, so I can check for swelling daily. And we're going to do the same thing to the top. I'm going to have Abby kind of support her leg up. I'm going to pre-cut my elastic on since she does have some hair. We're going to go right around it, making sure that I'm not getting any of her hair. Alright, there we go. And that's the modified Robert Jones with the splint. Okay. To take off the modified Robert Jones with the splint, same way that you want to take off the plain Robert Jones, you want to use bandage scissors that have one blunt tip edge. I'm going to go up and take each layer off at a time. Okay, so here's our first layer. We have our stirrups. We'll cut. And then our second layer, we'll cut, making sure that you don't cut the splint, of course. we can safely remove our splint. A little trash pile. Now you can take off the last layer, which is just your cotton cast padding. The difference between the modified Robert Jones and the regular Robert Jones is the modified Robert Jones bandage is much thinner than the regular Robert Jones, which uses a super thick cast padding. All right, now I'm just going to remove my stirrups. Nice and easy. All right, and that's how you remove it. We're here with Tugboat, and we're going to show you how to put an emergency tail bandage on him in case you would use this if he got his tail stuck in a swinging door. It's all right, Tugboat. All right, so what I'm going to do is I'm going to start where his wound is. Let's say his wound's right at the base, which they normally are, especially if they get something called happy tail, if he's boarding and kind of banging his tail up against the cage. And you start with a cotton layer. All the way to the edge. Okay, now that I have my light cotton layer on, what I'm going to do is I'm going to put an overlayer of the elastic cling, not making it too tight, and wrapping it 50% down at a time. Making sure I don't have any real crinks or creases in it. Alright, now I'm going to take my bandage scissors, cut the contouring gauze. Alright, and my tertiary layer is going to be that of vet wrap, making sure I don't do it too tight. I'm doing it about 50% of the time intervals. Okay. Alright, and your last is going to be just this elasticon. You just want to put one layer lightly at the top to hold it on. Alright, and then if he had a problem swinging his tail back and forth, you could actually take a syringe casing and put it on the edge and tape it around the edge. That way he won't continue to cause damage even with the bandage on. Just like that. That's an emergency tail bandage. So when a patient comes in for an emergency, the best thing to do is to triage first. It takes less than 30 seconds, and when you triage, it tells you what's going on. That way you can communicate it with your staff members, and somebody can start the life-saving tools that are needed to help this patient in the crisis. You should always have a stethoscope. Do a good exam on your patient very briefly, very quickly. If they have an open wound, advise somebody to apply direct pressure. They make sure you check with your stethoscope if they have a heart rate, if they're breathing, check their mucous membrane color. They do not have a heart rate, you need to start chest compressions, which I'll go over in a little bit, immediately. They're not breathing. Once you start the chest compressions and get those underway, you want to have an endotracheal tube in and start with your ambu bag, the rescue breathing technique. So simple triaging is how you should start. Once you start everything, then you can. All right, I have Mimi here. We're going to demonstrate how to do CPR on a patient. Mimi's not in an emergency type of situation, so we're not going to show you how to do it on an emergency type of situation due to time and since it would be an emergency, but we're just going to show you the location that we would perform CPR. We will do this the same for our surgical patient if she were to go into cardiac arrest on the surgery table. The only advantage to that is that they do have an endotracheal tube placed already, so you can have somebody using the ambu bag start that immediately. But for Mimi, she weighs about 15 pounds. She will be on her side in lateral recumbency. You will take one hand and place it over the heart. You will take your other hand and place it over that, and then start with your even chest compressions going down. Your goal is to do about 120 to 130 per minute. So you're really working hard doing these chest compressions. You'll have somebody rotating with you about every 2 to 3 minutes, just because this does get tiring. You want to have somebody check for the pulse and the heart rate using their stethoscope every couple of seconds to see if you do regain their cardiac function. We always have an emergency drug box here at the hospital also that has a sheet with it that tells you the routes to safely give the emergency drugs if they are in a true cardiac arrest moment. And the drugs in there are things such as Lasix if they're going into congestive heart failure and they suddenly stop breathing. There's epinephrine that we use almost for every emergency. There's atropine, there's sodium bicarbonate, there's mannitol, and the dosing is right there, and you can easily calculate it. Typically it goes per 10-pound dose, so you can give a good quick reference range in your head. For Mimi, we would estimate that she would be about 15 pounds or 10 pounds. An emergency type of situation, it's really good to rotate with somebody so you don't get burnt out. Same on the surgery table, and you just want to make sure that you stay calm. You're a technician, you're there for the doctor, but you also need to keep in mind the basic triage. If Mimi was to come in for an open wound, we would treat her with a bandage. For the open wound, we would apply direct pressure with a 4x4 gauze to stop the bleeding. Immediately we will hold down that direct pressure, and you will have somebody else doing CPR at the same time. It's important to have all of your team members there helping you, doing something, and not just standing around looking at you. You want to be direct, know how to order somebody during an emergency situation if you need them to do something, and also hopefully all of your team members have a good general knowledge of how to handle an emergency type of situation. So the most important thing that recent studies have shown is to get your heart working first by doing your chest compressions. Once you obtain a heart rate, then you want to start working on getting them to breathe, and we'll show you how to do that. You want to have a good endotracheal tube, place an endotracheal tube, and start using your ambu bag immediately. Alright, this is our ambu bag. Our ambu bag's pretty nifty because it hooks up directly to the oxygen system that we have in our hospital. So it can run off room air, but it can also run off 100% oxygen. So we have it hooked up to our oxygen system now. Our patient would be intubated, and then we would attach the end of the endotracheal tube to the ambu bag, and this would be in the patient, and we can give them 100% oxygen breaths that way and start breathing for them. This is typically done while somebody's doing the chest compressions at the same time. So you want to start, like I said earlier, with your chest compressions. Once you get those underway, if they are going into cardiopulmonary arrest, then you want to get an endotracheal tube in and start your ambu bag breathing for them. Okay, we're here with Cooper. We're doing a routine dental cleaning on Cooper, and we're going to start by first telling you that he is hooked up to anesthesia. We use the isoflurane O2 combo. We have our monitor on him. He is on IV fluids, lactating Ringer solution with a 5 ml per kg per hour drip. And our technician, Kelly Crooks, is here. She is monitoring, and she is here for if I have any questions, and to double check everything that I'm doing since I'm not licensed. So we're going to start by doing just our normal mouth exam on Cooper. I'm going to open up, examine all of his teeth. We have done pre-anesthetic blood work on him, which was all normal. So seeing that he has some tartar on his incisors, his canines, just a mild amount of tartar. Nothing huge. Okay, and then with any patient, we'll do a pre-picture because we like to send them home with a good picture. And Kelly's gonna hold his mouth open a little bit. Okay, perfect. And on my initial exam, I don't see any fractured teeth. I'm always checking for that. I don't see any fractured teeth, no broken teeth, broken tips. The gums look a little red and inflamed, but nothing too serious. The redness is around the tooth. All right, so now I'm going to do my initial rinse. Have my water and angling it downward. Just rinsing. Okay. And now I'm going to use my ultrasonic scaler and start the scaling. So I always start at the top with the incisors, making sure with your scaler that you don't put too much pressure or focus too much on one area at a time. The book and Kelly both suggested if you're having a hard time getting some tartar off, to move to another area and then come back to it and work to get it off. But his are coming off very nicely. And with this tip we can go up into the gingival line to get some of it off. Okay, and we're just going to show you, to save time, show you the probing technique and the hand scaling that we will do after we have finished with the ultrasonic scaling. Keep in mind I haven't finished all the teeth. I've only done these 3. So this little area right here we can get some more off, but you can see I'm testing to make sure there's no tartar above the gum line. There's no deep pockets. I can take my in and measure the pockets. Okay, I'm actually take my ultrasonic scaler and hit this area one more time. Okay, once I finish that, I'm going to do a rinse. Okay, now we're going to do the polishing. I have my paste here. My cup up with. And then go around each of the teeth. Give them a good polishing. Since I created with the ultrasonic scaler and my hand scaling, little pores and blemishes on the teeth around the enamel. So I'm going to try to fill those in. Okay, making sure that I get all the sizes. Okay, I'm going to take and rinse. Okay, and the final step is going to be my chlorhexidine rinse that I'll put on. And then I'll put my fluoride treatment. And we use the CET Fluorofoam fluoride treatment that has a 1.23% fluoride. And then let that work, and then we'll blow it off after a couple seconds. And that's a dental. Good dental home care is vital to a pet's overall health. There have been many studies that show that poor dental care can lead to diseases such as heart disease, diabetes, endocrine diseases, and a variety of other diseases, heart disease being probably the main one. So it's very important to educate your clients on good home dental care for pets and also just overall good dental care. Anytime a patient comes in for a dental procedure, we do go over at-home dental care. We also go over dental care in the exam room when a patient comes in for their annual exam and vaccines. We explain the importance of brushing your pet's teeth on a regular basis, starting out with goals, such as starting out slow and then working your way up, such as every Sunday morning brushing your pet's teeth, then working up to twice a week, and so on and so forth. We know in an ideal world you would want to brush your pet's teeth every day, if not twice a day, just like you or I. However, day-to-day life gets in the way and that doesn't always happen. So setting realistic goals will help the client follow through with them and help your patient and their pet with better dental care. We do send home a dental packet after every dental procedure, and the dental packet a variety of different treat options which are certified by the American Dental Association. They are chews that help with breaking up the tartar, greenies, which are great, they have chlorophyll in them, help with the plaque, and then we also send him a bag of Hill's Prescription TD, which is their dental health food. We send that home complimentary just so the clients can get in a good habit, and also we have a brochure for every product so they understand why we're sending it home, the importance of it, and how easy it is to just give them a treat or a bone, and of course brushing their teeth. But it's super simple and it definitely helps their longevity in the long run. We also send home a toothbrush and toothpaste. We explain to them that you never want to use human toothpaste. You want to use CET, this is the brand that we use, animal toothpaste. It's an enzymatic toothpaste. So when we explain to them, and we always send home a finger brush, or we ask them if they would prefer a more toothbrush type mechanism. We always have a model, and we explain to them your goal is not to scrub every tooth like you or I when we brush our teeth. Your goal is to have your finger brush, load a little bit of the animal toothpaste on it, and simply go in a circular motion, starting with the canine and with your finger just working your way back. You're not going to get every tooth. You're definitely not going to get the inside of every tooth. But your goal is just to go in a circular motion on both sides and on the front, just to get that good enzymatic toothpaste working. And then if the patient has had a dental procedure here, we do send home a copy of their radiographs, and which include also before and after pictures. And we explain to them, because they've just paid, anywhere between $500 and $1,500 for their pet to have a dental procedure. A lot of times we do extractions here, or if the tooth can be saved, such as an upper canine tooth or a lower canine tooth, we'll do a pulpectomy or a root canal. So these are all things that we like to go over with them and explain, this is what we did. This wasn't just if you or I go to the dental procedure. We have to put them under general anesthesia. We do take full mouth dental radiographs here. They are digital, so we send them a copy of those. And then with our digital camera, we take before and after pictures, because a lot of times the owners just see this portion, or this portion right here, this window of the dog or cat's mouth. They don't look in their mouth every day, and a lot of times they never look in the back to the premolars and the molars. So it's always a good idea to show them full mouth before and after pictures so they can really see how good their teeth clean up. That way, once you start with a fresh slate, you can start with your at-home dental care.